United States Healthcare System by Bethany Orvis, HCA 205, Instructor Dean, July 20th, 2015. Introduction. Who am I? Good afternoon. My name is Bethany Orvis. I have been married for 16 years. I am a mother of 4. I have 2 boys and 2 girls. My 2 boys are both on the autism spectrum scale, and my oldest son also has Down syndrome. Today I will be doing a presentation on the United States healthcare system. The presentation will include the history, the major developments that have transpired making healthcare what it is today, and the different stakeholders and the roles that they play within the United States healthcare system. I will also be including in this presentation the reimbursement methods, technology, and its role in healthcare, including the increase in cost. This presentation will also address the U.S. healthcare system in the Netherlands and talk about healthcare reforms, improvements, and the future of healthcare within the United States. The U.S. healthcare system. History of the U.S. healthcare system. While some forms of medical treatments have always been around, it was not until the 1750s, with the opening of the first medical hospital in Pennsylvania and the first medical school in Philadelphia during 1765, that doctors started receiving medical education. In 1837, Congress ordered the building of the first U.S. Marine Hospital. This hospital was built in order to help the seamen, boatmen, and others who traveled on the western rivers and lakes that became sick from disease such as yellow fever, cholera, smallpox, malaria, and drunkenness. In 1768, President John Adams signed into law the Act for the Relief of the Sick and Disabled Seamen, which made medical relief available to all seamen, and in fact this later led to the first example of prepaid health insurance in the U.S., which was used to help pay for medical care or the building and renting of hospitals. The history of the U.S. healthcare system continued. The American Medical Public Health Association was established on April 18, 1872 in Atlantic City, and in 1879 the National Board of Health was created. Although while many individuals were already seeking to improve health, cleanliness, and quality among the public, the American Medical Public Health Association was created by a group of doctors in order to help prevent illnesses by promoting clean water, the washing of hands, etc. In 1798, shortly following the building of the first Marine Hospital, Congress established the U.S. Marine Hospital Services for Seamen, which allowed for a small monthly deduction to be taken from their monthly salary in order to help pay for the building of more hospitals, rentals, and care. However, from 1850 to 1860, the first accident policy was established in Massachusetts in order to help protect against lost wages due to accidents. But it was not until the 1870s and 1880s that companies started to offer medical coverage. In 1929, the vice president of Baylor University Institutions in Dallas, Texas, struggled with the fact that teachers and patients were having a hard time paying for his or her medical bills and decided to find a way where this could be possible. Kimball proposed a plan that would guarantee Dallas school teachers 21 days of hospital care in a semi-private room for 50 cents a month, and by 1933, community-wide plans appeared around the U.S., and the American Hospital Association began to encourage, regulate, and improve similar payment plans. Major developments in the U.S. healthcare system. Healthcare has gone through many different types of changes over the course of history, starting with the first Marine Hospital and the Seamen and the Teachers Union in Dallas, Texas. Healthcare has had its ups and downs. During the Great Depression, many could not afford hospital care, let alone health insurance. Financially, government has been funding healthcare since the first Marine Hospital was built, and Congress signed into law the Act for the Relief of the Sick and Disabled Seamen. While seamen received a 20-cent loss in wages every month to cover the cost of health care in some form or another, government picked up the rest of the cost. In 1946, the Hill-Burton Act was signed into law, making it so hospitals could no longer discriminate against those of a different race, whether it be refusing service or simply charging him or her more money. The cost of healthcare have continued to rise not only through the building of new hospitals, but in 1965, President Johnson signed a bill into law that would allow for the low-income, disabled, and elderly, 65 and older, to receive health care insurance, known as Medicaid and Medicare, which is a separate government-run health insurance paid for by taxpayers, and later in 2003, President George W. Bush signed the Medicare Prescription Drug Improvement and Modernization Act, which authorizes Medicare coverage of outpatient prescription drugs, as well as a bunch of other changes to the program that cost taxpayers between $2,323 and $534 billion a year. With the signing into law the Medicaid and Medicare, millions more became insured and medical costs skyrocketed. Medical costs still continues to rise as technology increases and as more and more Americans lose their jobs and go on welfare. During the early 1980s, corporations started taking over and prioritizing healthcare by integrating into the hospital system, causing a rise in health insurance for individuals, leaving more and more uninsured. Today, the United States government has expanded healthcare insurance by way of the Affordable Care Act to all residing within the U.S., whether or not they can afford health insurance, saying that while the costs are up now, eventually the cost of healthcare will go down. However, some individuals have lost his or her insurance because of the new bill, while others have had their rates increased dramatically, making it almost impossible for them to pay his or her own health care. It appears as if the financial, legal, ethical, regulatory, and social aspects of healthcare all intertwine with one another. Individuals demand free healthcare, which in turn causes laws to be passed, citing ethical reasoning, and financially the cost will keep rising on demand as technology increases. Stakeholders and their roles. Stakeholders are those who have an interest or concern regarding something in particular they are investigating. Healthcare professionals such as doctors have a stake in healthcare in that they depend on it for their very livelihood and reputation. A healthcare professional's role is to provide quality care for his or her patients in the best way that he or she can through education, accurate diagnosing of a patient, referring the kind of care or therapy one may need, and through kindness. A healthcare professional can also play a role in research and data collection, providing useful information to others. The payers are corporations such as private insurance companies, the medical branches of government, and so forth. These payers focus solely on the cost of healthcare while seeking to cut costs. Employers are investigated in keeping the cost of healthcare down for not only themselves, but for their employees, as well as getting his or her employees back to work as quickly as possible. Patients are solely seeking compassion, kindness, good care, including accurate diagnosing. Political figures in healthcare have a stake solely based on the fact that the country looks to them and will blame them for the failure or praise them for the success. For example, President Barack Obama is the political figure behind the Affordable Care Act, and he will be the one to rise or fall based upon his success or failure. Cost of the U.S. healthcare system. The cost. Healthcare is not free by any means. Someone somewhere has to pay for it. There are many different ways healthcare is paid for. For example, out of his or her own pocket, through private insurances, a charity, employee plan, or government, which in turn means the taxpayers. In 2009, government spending on healthcare was at the all-time high of 49% because of Medicare and Medicaid. According to the article in Business Economics 2006, Medicaid, which is the insurance for the elderly, costs nearly a quarter of the state's budget and is looking to increase over the next 10 to 20 years. However, while the amount varies from state to state, states do get a percentage of money from the federal government to go towards the funding of Medicaid. There is some contradiction about who actually pays for Medicare, but according to Medicare.gov, Medicare is funded through several avenues, including all who pay taxes, such as employers, employees, including those who are self-employed. Many who have private health insurance have procured it through an employer-sponsored financial agreement known as cost sharing, which means that the employees now have a part of the employer's group insurance plan, subsidizing the monthly premiums in order to make it in order to make it more affordable for his or her employees. That being said, private insurance premiums can still be very expensive for employees, let alone for those seeking private insurance on their own. Many times, one not only pays for his or her own premium, but also may have to pay a co-payment and co-insurance or meet an annual deductible. Before the passing of the Affordable Care Act, many private insurance companies did not accept those with pre-existing conditions. However, private insurance companies can no longer deny patients with pre-existing conditions. The downside to this is that cost is much higher than average. According to Custer, healthcare cost inflation has increased the cost of health insurance, increasing the portion of compensation devoted to benefits and reducing both the number of employees who offer coverage and the number of employees who participate in coverage when it is offered. However, with the new health insurance exchange program, many are hoping this will help drive down the cost of health insurance. Reimbursement methods. We know that medical care professionals, clinics, hospitals, etc. get paid through Medicare, Medicaid, private health insurance companies, and cash patients, but who determines how much he or she gets? When it comes to reimbursement methods for service rendered, there are 4 reimbursement plans that are used between government and private health insurances. These are fee-for-service, discounted fee-for-service, capitation, salary. With fee-for-service, healthcare providers get paid upon the service they provide, meaning that he or she will get paid for every patient he or she sees and every service they do, including tests. However, the cost varies depending on who is being seen. For example, if the patient is on Medicare, then the doctor gets paid whatever the state has set for the rate per service, whereas a patient with private insurance pays a discounted fee for service based upon a fee schedule or a predetermined discount. Capitation is a contract that is between the health insurance company and the provider. This contract means that a physician, clinic, or hospital will get reimbursed with a fixed prearranged monthly amount for every patient that is enrolled in a capitation contract, regardless of how much treatment he or she may need or receive. When physicians are salary, he or she is paid a fixed weekly or monthly amount that is not linked to services rendered or those enrolled. How do healthcare plans pay physicians? Managed care organizations or organizations that contract the healthcare facilities and medical providers to provide care at a discount price for those who are members of said organizations, such as HMOs, preferred provider, and point-of-service organizations. Technology's role in healthcare and its increase in cost. When it comes to technology in healthcare today, it is both expensive and needed. Technology is one of the main reasons that healthcare's costs keep rising. Although most medical technology R&D is privately funded, it still costs hospitals and clinics a lot of money in order to have the new technology. Medical research has saved lives by using technology to study diseases. Better technology allows for better microscopes, computer systems, and robotics in order to study deadly diseases with little human risk. Technology combined with medical research also allows for robotic surgery, and now researchers are working on creating nanorobots in order to play an active role in medical applications and interventions within the vascular system and other areas where one cannot get into due to lack of proper tools. Better equipment often means more accurate results. For example, when it comes to 2D ultrasound, one can see many things such as the possibility of octophilia, which is an extremely rare malformation of the face. However, through the use of 3D ultrasound, doctors are able to confirm this diagnosis and help counsel parents, as it is most likely that the infant will die shortly after his or her birth. Technology's roles continue. Switching to an electronic health record keeping system, if done right, could be a very important thing. The downside to the current system is there are too many systems and they do not talk to one another. This means that patient records are not easily accessible from one doctor to the next. However, in talking to a healthcare professional who is in the process of switching all of their records over to the electronic system, she stated that it is not just their facility, but rather the whole United States is switching over to one system. It's supposed to be EHR, meaning that a patient's records will be able to be looked at anywhere in the country without the patient having to give his or her medical information every time he or she sees someone new. The downside to this record system is there are still bugs to be worked out, and it is still vulnerable to hackers, and most likely there will not be a paper backup system. Technology has made it so that the delivery of quality of care is more readily available. For example, individuals are now able to search the web for symptoms, such as through WebMD and the Mayo Clinic, in order to find out if he or she has had he or she has a simple cold or pain, or whether or not one should see a doctor. Physicians are also able to access research, medical journals, studies, and take webinars via the internet. I'm trying to read too fast. Which in turn leads to better care for his or her patients. Not only does technology in healthcare play an important role in the U.S., but also other countries. For example, with technology comes telemedicine, allowing for those in other countries to communicate with medical professionals in our own country, allowing for them to learn from one another and to provide health care in areas that lack schooling for physicians. Technology has allowed for the use of mobile services, including blood donations, vaccination services, diabetes screening, and heart screening. And I am out of time.